Hi, welcome to You and Your Health. I'm your host, Dr. David Bertone. Today's show is about an exciting topic. It's called regenerative orthopedic medicine. And these are things that have been in the news lately, things like platelet-rich plasma or blood spinning. There's also stem cell grafts that are used and prolotherapy. These are exciting cutting-edge techniques that are being used on common injuries like chronic tendonitises and arthritises and chronic pain syndromes. And we have an expert here today to talk about this exciting process. With us today is Dr. Edward Magazina. Dr. Magazina is board certified in physical medicine and pain management. He's also the CEO of the New Jersey Interventional Pain Society and the assistant professor at New York Medical College and a clinical professor at Robert Wood Johnson. Thank you, Dr. Magazina. Welcome to the show.
Hi, how you doing, Dave?
Good. Thanks for joining us.
Thank you.
And I also want to say that you were a former physical therapist like myself.
I was. I did that back in the 70s.
Excellent.
Yeah.
So give us a little background about what you're doing now and how did you get involved in this type of medicine?
Well, I would say I started at St. Peter's Hospital. I was there for 3 years, and I was treating people with cortisone injections and things like that, doing the standard techniques. And I was not getting the results I wanted. After a while, the cortisone just stopped working, and people need to come back, more frequently. And I said, there's got to be a better way. And I remember actually reading in a physical therapy journal about a technique called prolotherapy. And I said, well, let me go back and find out what that's all about. And it was a regenerative technique, and I learned that back in 1994. I took a course in that, and I did that for approximately, and I still do it, for approximately 8 years until I started adding the new techniques to my practice. But prolotherapy is a regenerative technique. It's been around, probably about 70 years. It started in the 30s, and you asked me about history before, and history of prolotherapy actually goes back to Hippocrates.
Okay.
Okay, the father of medicine there, and he would treat javelin throwers that had like injured shoulders, rotator cuff, or dislocated shoulders, and he would take hot needles and place them into the shoulder. Mm-hmm. And these hot needles would cause an inflammation or a tissue reaction that would somehow cause some scarring or some healing to occur in those shoulders, and then they'd get back to their javelin throwing. In the 80s, they were using irritating substances for healing hernias. In the 1880s. Okay. And in about 1935, they started using prolotherapy solutions. So it really started then on orthopedic type problems. And it wasn't really till the 1950s, Hackett and Hemwall, really, and Ongley are the fathers of this technique, prolotherapy. And it really took off, I would say, in the 80s and 90s. And now, as we go around to different society meetings and courses around the country, everyone wants to know about these new regenerative techniques, and prolotherapy is one of them. Want me to tell you how it works?
Yeah, let's first,
Sure.
I mean, you mentioned the word regenerative orthopedic medicine,
Sure.
which is kind of, most people, when they hear the term orthopedics, they think of an orthopedic surgeon. This term came about because you're trying to use the body's own healing properties to regenerate tissue. Is that correct?
Exactly right.
Okay.
People don't really think about it much, but the body heals itself every single day. All right? If you break a bone, it heals. If you cut your skin, it heals. If you burn yourself, it gets better. If you go for surgery and they make a big wound, cardiac surgery, they put a few stitches in there. Stitches aren't what holds you together. Your body heals the wound. Mm-hmm. And what happens is the inflammation that occurs from that injury causes a signal flare to occur, similar to if you broke down in your car and you put the flares in the road. And those signal flares, that inflammation, causes the bloodstream to release the growth factors, the platelets, and the stem cells down to where that signal is, or the injury. And that's pretty much how prolotherapy worked. And nobody really understood back in the 50s and 60s how it worked. They just knew that it worked. Mm-hmm. It wasn't until we have more advanced scientific methods now that we actually know that you can see the increased growth factors that are in that area when you put in medications like dextrose and things like that.
So if you have an injury, say if something is separated like a tear,
yes,
normally people would think about that the surgeon has to bring those two parts together for them to heal. Is that what occurring with this process, and can you do it for things that are separated or torn?
Depends how far the tear is and how large of a tear. Certainly large tears need to be brought together surgically. But smaller injuries and smaller tears can be brought together naturally. I mean, many times, the body injures itself and it heals without surgery. Right? They didn't have surgery back in the 1700s and the 1600s, right? People would still get better. Even today, if you tear your Achilles tendon, that's a common injury. It used to be that they would always sew them back together, and now they just put you in a cast, if it's not that bad of a tear, and it heals on its own. Because the body has the capacity to heal. But the message of healing may only last 6 to 8 weeks. So if the body hasn't completely healed itself in that 6 to 8 weeks, then the message of healing might be lost. And that's where prolotherapy comes in and these other regenerative techniques come in, because it sets a biological signal back into that tissue so that the body knows that that tissue needs to, to be healed.
Excellent. Let's talk specifically about some of the techniques, and then we can go back and go through like a typical patient workup.
Sure.
One of the things that's kind of in vogue, and people hear it in the news all the time because the athletes are getting this platelet-rich plasma therapy or blood spinning. Can you just explain what that process is real quickly?
Absolutely. There's 3 phases to this regenerative medicine, and eventually we'll see a 4th phase. But prolotherapy was phase 1. The platelet-rich plasma is phase 2. And stem cell grafts and things like that I call phase 3. Platelet-rich plasma is in your body, all right? It's the platelets. And the platelets carry growth factors in them. In fact, there's over 200 growth factors inside of the platelets. But there's 5 or 6 main growth factors, and these are the same growth factors that the body uses to make a new baby, for example, all right? These things circulate in the bloodstream, and it tells the body what to do. So what we do is take the blood, and we extract the platelets, and inside of that blood and the platelets,
like a matrix,
right? We also have approximately 170,000 stem cells. So it's a combination of things. There's white blood cells, there's platelets, and there's some stem cells. And we'll take that, and that is the cream of the crop stuff that the body uses to heal a ligament or a tendon injury or a muscle tear or something like that. So we take the stuff that the body uses to heal itself and we transplant it exactly where the injury is. And the way I do it is under ultrasound guidance or x-ray guidance, so we put it exactly where the body needs it.
So do you inject it? Is it surgically implanted? How is it done?
It's done what we call percutaneously, so it is injected. It's a relatively painless procedure. And I use image guidance, so we put it exactly where the known tear or problem is.
Okay.
Yeah.
And you're taking the substance, you start with just a person's blood, and then you send it to a lab?
No, we draw the blood in the office. And I'm not the only doctor in the country doing it, although I was probably one of the first 1 or 2 doctors in the country to start doing this. But it can be done in the office. We have special kits that are FDA approved. The whole procedures has been recognized by the FDA. And we can draw the blood, put it into the kit, and the kit, through a centrifuge process, extracts the important layer of platelets and white blood cells that we use for the treatment.
All right, so you do it that same day. You're pulling the blood, spinning it, and putting it right back into the spot.
It's done right away, yes.
Okay. So we'll talk about some of the specific techniques and which conditions you use it for.
Sure.
But let's move on now to the prolotherapy. You said that was kind of the first step in the process.
Yes.
So explain what prolotherapy is.
Okay, prolotherapy is the injection of irritating substances that creates an inflammation in that tissue that acts as a tissue marker, as I was saying, so that the body knows that it has to send down the platelets and other growth factors in that area to heal it. And you can use prolotherapy anywhere that you have an injury, whether it's arthritis, a tendon problem, a muscle problem, or a ligament problem, and force the body into a healing phase. Now, one treatment might not be enough, all right, because it may only heal at 10 or 20%. But if you hit that area that's injured 2, 3, 4, 5, or 6 times, you can actually continue that healing process, which usually only lasts about 6 weeks. You can make the body heal itself by going through that healing process over and over again by remarking that tissue with the irritating prolotherapy solutions. Be similar to what an orthopedist might do when he scrapes a bone and he's trying to get a tennis elbow to heal, or if he has a fracture that's not healing, he may go in there and scrape the
microfracture surgery. They'll drill into the bone.
Drill into the bone to get circulation to go into the area. These are techniques that have been done in orthopedics for years, but no one really realized how they worked.
Now, what is the substance that you use?
We use different things like dextrose and glycerin and very small and minute amounts of phenol. These are all substances that are used in the body in other areas of medicine that we've adapted and use off-label for the use of this technique.
And when do you decide to use the dextrose versus phenol?
Well, each of the solutions have a different strength to them.
Okay.
So it depends how much of an inflammation that we need to get the body to kickstart itself to go into the healing process.
So one is better for tendon injuries, one is better for joint problems.
Yeah.
Is that how it works? Or you would start at a lesser...
We start at the milder solutions.
Which is
and
glucose, I would assume?
Right, and then we work our way up from there depending on what the patient needs.
And really the intent is just to irritate to get the body's system to fire.
It sounds too simple to believe and to be true, but if I can just reflect, and this is what I tell my patients, every day in medicine you've got plastic surgeons and dermatologists making you look younger. Okay, they're using lasers, they're using dermabrasion, they're using chemical peels, they're using it on your face in different places. And you grow new skin and you grow new collagen, and wow, you look great after those dermatology treatments. But let's think about what are they doing? They're blasting the face with sand. They're taking a hot laser and giving you a second-degree burn. All right? They're taking acid and throwing it on the face with the chemical peels. And underneath, they're growing new skin and new collagen. Works the same way as those techniques, but we can apply that for orthopedic principles.
That's an excellent analogy.
Thank you.
Let's move on to the stem cell grafts. So you said first there's prolotherapy, then there's the PRP, and then the stem cell grafts. Can you just explain what that is?
Sure. Stem cells is really what we're trying to get, even with the platelet-rich plasma, okay? Because the PRP, platelet-rich plasma, has growth factors in it which attract stem cells to the region. So if you want to regenerate tissue, you need to get stem cells down in that area, or you need to get the tissue that's there to reproduce itself. So if you can go to the next step and actually get the body's stem cells and then transplant those stem cells and tell those stem cells what to do, then you can repair an injury, you can help heal arthritic problems, you can, it's really infinite. I mean, if you look on the internet and put in stem cells and medicine, you'll get 1,000 articles on there. They're using it for heart problems, they're using it for neurological diseases. There's a lot of research involved now with stem cells for healing all types of things. They're even growing new organs and body parts with stem cells and putting scaffolds, and then scaffold is like a plastic paper mache thing, only it's of a biological material. And then they'll seed that with stem cells, and they'll make a new urinary bladder, or they'll make a new trachea or something like that. So we're using it for orthopedic purposes, basically.
Okay, wonderful. When we come back, we're going to talk specifically about what conditions can benefit from these cutting-edge techniques.
Alzheimer's disease, if left unchecked, will strike millions, including baby boomers, their children, and grandchildren in the coming years. As a scientist studying Alzheimer's disease for the American Health Assistance Foundation, I'm well aware that continued research is our only hope for finding a cure. Call 1-800-437-2423 or visit ahaf.org for free publications on Alzheimer's. Learn what you can do to help battle this deadly disease.
Hi, welcome back to You and Your Health. I'm your host, Dr. David Bertone. Today's show is with Dr. Edward Magazzina. We're talking about regenerative orthopedic medicine. Dr. Magazzina, again, welcome to the show.
Thanks for inviting me.
We were talking before the break about some of these techniques and stem cells in particular, and I think it's important for you to clarify What do you mean by stem cells? Because sometimes in the news people hear different things about stem cells, and maybe they're coming from babies or whatever. So can you just clarify that topic?
Absolutely. I think it's very important. I mean, for over a decade, we've been bogged down with embryonic stem cells and getting them from babies and having to expand them and things like that, and then it might cause cancer, and it's all in the experimental stage and all. But we don't use those. We don't need them. The science has jumped ahead of embryonic stem cells, and we're using adult derived stem cells, which are called mesenchymal stem cells. So we're using your own stem cells that are in the body to help heal injuries inside of the body.
So you take it from the person,
right?
And then what do you do with it? Do you have to spin it or clean it or anything?
Right. We have a special process that has to be centrifuged and filtered out. And then, for example, let's say we take 60 cc's of bone marrow. Out of that, we might get 9 cc's of actual stem cell mesenchymal product that we can use in the treatment course.
Okay. Now, one person that's been in the news is Bartolo. He's
Yes.
a pitcher for the New York Yankees.
Yes.
He had some kind of stem cell grafts done in the Dominican Republic.
Yes.
Do you know anything about this particular technique, and is that being done here in the United States?
Actually, it is. I know the doctor that did it. I spent a couple days down in his clinic in Florida.
Okay.
Dr. Parita is an orthopedic surgeon, board certified, well respected. And what he does is he also uses the bone marrow stem cells, but he's also developed a technique where you can get stem cells from fat. In actuality, they've discovered, not him, but it's well-known fact among the plastic surgeons and others, that there's 1,000 times more mesenchymal stem cells per square inch, so to speak, in fat than there is in bone marrow. So he's perfected his technique down there, and as well as getting stem cells from fat. And I believe he probably used a combination of things, either bone marrow or fat-derived stem cells, for treating you know, that Yankee player. And of course he did well. He had a torn rotator cuff, he had a problem with his elbow, repaired it. He was out in 2010, and in 2011 he's pitching 95 miles an hour.
Yeah. So if you think about some of the conditions that you would use these techniques for, chronic tendonitis, arthritis, you know, typical sports injuries, even chronic pain, can you just describe kind of the evaluation process when you first see a patient, and
Sure.
then how do you determine which technique to use?
Yeah. Well, the most important thing is listen to the patient, you know, hear what they have to say, and then come up with a diagnosis. You got to put your hands on somebody to feel what the problems are, and you as a physical therapist know that more than anybody. Then you compare that with the imaging studies that you have, you know, CT, MRI. I use ultrasound, which helps me look inside of the body to see all the soft tissues, nerves, and tendons. And once you have a diagnosis, then you decide what treatment is necessary for it. If it's something simple, you know, we can use that technique called prolotherapy, and cause a little stimulation for the bloodstream to send the platelets down in the area. If we have tears, or if we have significant arthritic problems, or cartilage problems, either in the shoulder, or the knee, or in the ankle, then we might go to something stronger like the PRP, or platelet-rich plasma. I would say it's probably about 5 times more effective than the prolotherapy on those types of injuries. And certainly if you have really bad arthritis, large tears, then you might want to go to the stem cells, because that's even more powerful than the platelet-rich plasma. And sometimes we mix treatments. You know, I might treat the ligaments around the knee with the prolotherapy, but inside the knee, if there's a meniscus cartilage damage, we might use either the platelet-rich plasma or the stem cells inside the knee. And in any one treatment, you might mix, you know, mix platelet-rich plasma with the stem cells.
Okay.
Because the PRP actually tells the stem cells what to do. The stem
it.
cells are just, you know, stupid stem cells. All right, they go down to the area, but then there has to be something in the body for it to recognize that tissue of what it needs to turn itself into. And the platelet-rich plasma and putting it in the right place helps the stem cells to differentiate into what you want it to turn itself into.
Now, when you talk about arthritis, I mean, there's some arthritic conditions where it's just so much degeneration. I'm assuming that if the people are too far gone, then they need, you know, surgical reconstruction, replacement of the joint.
Absolutely.
How do you determine what level would benefit from something like that?
Yeah,
is
a lot of it depends on the person's
impairment?
age and the degree of arthritis and what their goals are. I mean, if they absolutely do not want surgery, then these treatments can relieve pain for a period of time. You just might have to repeat it, in 6 months or on a yearly basis, and you can get long-term pain relief. One of the things that I discovered early on, I've been doing this since 2002, is that the PRP is not just a regenerative technique. It's an extremely potent anti-inflammatory technique. When I say anti-inflammatory, I mean you can have an anti-inflammatory effect that lasts for a couple years or more. All right, without getting too bogged down with the science, which I know you would understand, but our public wouldn't. There are some very bad players inside of a knee or in a joint, all right, that are causing that knee, for example, to continue itself towards developing worsening arthritis. And once those bad players in the cartilage, those genes are turned on, it'll be turned on indefinitely. So one of the things that platelet-rich plasma does, it has reverse antibody type genes, which will shut off those bad interleukins, just to throw it out at you, which is causing the inflammation, arthritis, and shut down that inflammation.
Okay,
so,
but is it going to reverse it if you have degenerative articular cartilage in there in the joint, and that's the lining in the joint people know as kind of the shiny part of a chicken leg?
Yes.
Will it help regenerate that?
If you have absolutely no cartilage left, no.
Okay.
But the anti-inflammatory effect in itself can reduce pain. If you still have some cartilage inside of the joint, the research does bear it out that platelet-rich plasma and especially stem cells can cause some increased layering to occur inside of that cartilage.
So again, it's similar to what the surgeons do with the microfracture surgery. They kind of drill holes in the bone. They try to get the blood down there to regenerate the articular cartilage.
Exactly.
Instead of doing that, you're going to inject the person's own blood in there, stem cells, platelets, to stimulate kind of from the opposite direction.
Exactly. It's all about the blood.
Okay.
Everything we need to heal ourselves is inside of that blood, and we have it, if the defect isn't too large. If you have a large defect, all right, one option is to treat it surgically. Another option is to use some type of scaffolding technique to gap the defect and then try to seed that scaffold with stem cells. And one of the things people are doing is filling defects with fat grafts.
Okay.
For example, and that sticks to the area, and then you can see that with the stem cells to help to repair it.
And you can inject the fat graft. You don't need to open the joint to put that in there.
Correct.
Okay.
It's thick, so you need a little bit larger bore needle to get the fat in there.
And again, it's guided ultrasound, so you can see exactly where it needs to go.
Right. But large defects certainly need to be treated surgically. Large tears, things like that, where the knee is locking and buckling and all. We're not trying to take away business from the surgeon or whatever. The techniques we're talking about are being done by orthopedists all over the country. People that are thinking 21st century medicine and not 20th century medicine. Hospital special surgery, as we speak, are using stem cell therapy now with their patients over there. And they're using platelet-rich plasma at the hospital special surgery. All right, I get many of the patients that come from there or from New York come to see me because I've been doing this for so long. But the point is they're doing this at the Mayo Clinic and the Cleveland Clinic and all over the country now.
It kind of makes sense for people that may be not a clear-cut surgical candidate to try a less invasive approach prior to.
You're not burning any bridges. If it doesn't work after a series of treatments, you can always go ahead and get surgery and go for that. The key is to go to someone reputable that's going to tell you, has experience, that say, this isn't going to work for you, go for surgery. And you asked me the question, who's a candidate? If I had someone that was 70 years old and had advanced arthritis of the hip, and I knew by the time they're 80 that they might not be a candidate for surgery because of a cardiac problem or something, I'd say go ahead and get your surgery now. If I had someone who's 59 and it's too early to get surgery and they want to delay it, they don't want to be out of work for 3 months or whatever, then we have options that we can treat them with now. That's really the main thing. This gives people options and choices of what to do.
Interesting. You mentioned one thing, research, and I'm real big on evidence to support what we do in healthcare, because these days there's so many different techniques, and if the research doesn't support it, people really shouldn't be doing a lot of it. So I'd like to hear some of the studies that have been done using these techniques. Obviously, they've been around a long time. Is there anything, you know, groundbreaking that says this is effective for these techniques?
Actually, there are.
Okay.
I've got on my jump drive in my pocket hundreds of studies.
Okay. We can post some links.
Yeah,
on
we're going to post
website.
some links, you know, for people later on.
Okay.
And tell people where they can go to look at these studies. And as we speak now, there's some major multi-center studies going on around the world on arthritis and you know, soft tissue injury repair and things like that.
Great.
But there's still plenty of studies, you know, that are out there that have already been published.
Great.
On this.
Another big question that people are going to have is, what does this cost? I mean, is this something that insurance companies will pay for? Is it strictly an out-of-pocket because there's maybe not enough research for the insurance companies to justify it? Where do we stand with that?
Yeah, there was a time where it was covered because, you know, the codes are covered. But I'd say about 2 years ago, the big 5 insurance companies came out with a statement that they're not covering it anymore. And I guess they're waiting for even more research to come out.
Is that every stage of it? Prolotherapy,
yeah,
PRP, and the stem cell?
Yes. At this time, I would say you know, most of your basic insurers aren't covering it.
Okay.
Workers' comp and some of the individual insurers look at it on a case-by-case basis, and they may cover it. It's unfortunate they're not, because I mean, our success rate, if you choose the right patients, are in the 90% success rate, and I'm sure I've saved millions of dollars in surgery costs and hospitalization costs for these insurance companies, and I would, you know, hope that someday that they would cover it. But in terms of cost, we have a cost of our equipment and buying the kits to extract the stem cells and growth factors, and it really depends on which treatment that you're getting in terms of how much it would cost. But basically, it's anywhere from $300 up to, you know, $750 for things like prolotherapy and platelet-rich plasma. But once you get into the stem cell costs, we have our laboratory kit costs, you know, that can be expensive. So that things like that could range anywhere from $2,000 to $3,000 to do a stem cell treatment.
Okay.
You know, it's all relative.
Yeah, and it's still much cheaper than surgery.
Yes.
And it seems to be less invasive, obviously, and a good first step that some people can really benefit from.
Right.
I think it's a really exciting technique that hopefully some of the research will bear some better fruit, where the insurance companies will see that this is really going to save them a lot of money. Right. Because, you know, what we do is sometimes a little art with the science, right? And would you think there's some art to this still?
Sure.
Because it's, you know, the science is there, but there's still, you need to know where to put it, exactly how to put it, that kind of stuff, right? Is that
right? And there's a lot of people out there, as I said, that are doing it blindly, and they may not be getting the same results as somebody else that is not using image guidance or has some experience doing it. And the research is catching up.
Good.
So eventually, I'm hoping that will be a covered expense from that standpoint.
I think you make a really excellent point. There are a lot of people that do different techniques. I mean, you can go to different physicians now and do Botox and all kinds of things that maybe don't have the experience level. This sounds like something that you need to have some significant experience to be able to do it properly, and not just take the money from a patient and not get the results that they really deserve.
Yeah.
So
and there's just so many things you can do with it. I mean, there's so many areas of the body that you know, that can get injured, from the shoulder to wrist, hand, fingers, toes, knees, hips, you know, tendons and ligaments. Any of these techniques help to work on all those areas. Well, it sounds exciting. Thank you for joining us. Thank you very much. Thank you for watching You and Your Health. I'm your host, Dr. David Bertone. Today you've heard about a really exciting technique called regenerative orthopedic medicine. Hopefully you enjoyed the show, and until next time, we'll see you on You and Your Health.